Hi, everyone. Thank you so much for joining us for this Facebook Live Q&A to answer questions about COVID-19 and children, to offer a pediatric perspective on this pandemic. Today, I'm joined by Dr. Russell McCulloh, who is Children's Chief of Pediatric Hospital Medicine. Thank you for being here.
Thanks for having me.
Thanks for sharing your expertise. And we hope to help some people out there as we're all trying to navigate this pandemic together. If you have a question for Dr. McCulloh as we're chatting, please just put that below in the comments. We'll do our best to either get to that live or we'll respond later on our page. And up front, I know we want to say that this is a really challenging and wide-ranging topic. So our goal today in this format is to offer general information that really applies broadly, but we do want to acknowledge that there are just so many unique circumstances and specific situations when we're talking about COVID-19 and this pandemic. So starting on that general note, Dr. McCulloh, let's kind of rewind back to March, April. At the beginning, it seemed there was this prevailing sense, assumption maybe, that COVID didn't affect children, that they didn't get as sick, but we've learned a lot since then. So what is the latest that we know about COVID-19 and its impact specifically on children?
Well, for children who are under a year of age and for adolescents and young adults, they tend to be the folks who have the most symptoms of acute infection with the virus. I'll use this name a few times, so I'll start up front. The virus is called SARS-CoV-2, and it's the virus responsible for COVID, the acute respiratory infection that we see. Children who are in between those ages of 1 and essentially adolescence, pre-puberty, they tend to not have as severe of symptoms. And with those who may have underlying medical problems being the exception of being at risk for more severe respiratory disease. That what we've discovered since that time is that in addition to that acute COVID-19 disease, there is a disease called multi-system inflammatory syndrome in children, or MISC, or MIS-C, some may say, that occurs as a consequence of having been infected with the virus in a very small proportion of children.
So you definitely have learned a lot, and it seems to, every day, every hour, absolutely evolving. I know recently, especially as we've been talking about kids going back to school, and we were going to get into that more specifically later, but we're hearing about children being carriers. Maybe they don't get as sick, but they're carriers to other populations. What do we know about that carrier status? And then how many kids are just asymptomatic? You have no idea if they have it or not.
Boy, that is a hard question to answer because we just don't do as much testing in kids. What information we do know suggests that a child may be in one of a few categories when it comes to symptoms and infection. They may be uninfected and have no symptoms. They may be infected but have not yet developed symptoms. That's sometimes called pre-symptomatic, and may be at risk of transmitting the virus to other individuals, particularly in their household. They could be infected and asymptomatic, which may still carry some risk of infecting other individuals, particularly those in close contact. And then, of course, the last category being they have symptoms and they are infected, which is the easiest to find.
So is there research about children being carriers and infecting others? What do we know about that right now?
Again, just a little bit. There's some household studies from early on in the infection that suggested maybe around 1 in 10 to 1 in 20 children may be the person who infects other members of the household. And so the honest answer is that we don't know for sure the level. It's more than 0 for kids who are infected but don't have symptoms.
And so just remind us, if a child does have symptoms, what are those common signs?
The most common symptoms of COVID-19 are going to be acute respiratory symptoms, maybe fever, cough, runny nose, sore throat. Sometimes it can be symptoms of stomach upset, vomiting, diarrhea. At times it can also be muscle aches or pains. A lot of it looks like any other flu bug that you may have your child experience during the course of a year.
And if a child tests positive, they get the swab and they have it, how is it treated?
It is supportive care. There's a lot of talk regarding various treatments. For children who have mild to moderate symptoms, it's to help them basically stay as safe and healthy as possible while the virus is running its course. And so most of the time that's going to be fluids, Tylenol or ibuprofen for fever, and rest. The typical things you would do for a child who has, non-pandemic forms of coronavirus, which cause the same sort of symptoms.
So one question that we had, which is a really good one, are doctors seeing different symptoms in teenagers versus maybe, that elementary age and younger age? Are they different symptoms?
It tends to be that we see a bit more symptoms in general in teenagers. Tends to be more fever, more sore throat, more respiratory symptoms in older children. And so I'd say it's just more of the common symptoms, you're more likely to see them in a teenager.
Okay. Now, since day one, from the asymptomatic and testing those children to the children with MISC that you mentioned, Children's has been so involved in caring for these children to responding to the pandemic. In their community region, Children's Hospital.
You broke up just a little bit. Could you repeat your question?
Yes, and it's telling me, this is the fun of doing this right via Zoom. It said, your internet connection is unstable. We'll try again. Just giving people a sense of what Children's has seen in terms of the range of COVID-19 all the way up to that MISC in our hospital, in our community.
So the most common thing that we see is the mild illness. For Children's, we are running both urgent care, so it's kind of same day sick sort of visits. So we see those kids with mild illness all the way through to severe illness, which tends to occur in folks who have underlying medical conditions. And we are the regional referral center for MISC. We actually, the largest reports to date of MISC in children, we have included our information about children from our community in those reports, which I think is really important that our families be heard in that way, so that what we learn about this best reflects something about our own communities as well.
So you mentioned MISC, and what do you want parents to know about that? Give a little context to that condition, the treatment, but also maybe the frequency, or how rare is it if a child has COVID-19?
If you think about how many millions of people have been infected with the SARS-CoV-2 virus, a tiny fraction of children will experience MISC. And we don't have a way of predicting who they are, but it is an exceptionally rare event. We know that it is related to the way the immune system is stimulated by the infection. And we know that it tends to be post-infectious, meaning you've had or recovering from the infection and then that occurs. And we are treating it very similar to other inflammatory conditions that it can look like. So if folks are looking up on the internet, things like Kawasaki disease, we often, for those who look like they have a MISC and it looks like Kawasaki disease, they get treatment very similar. A lot of it is, and what we also know is that the vast majority of these children will recover. In the largest report that we were in from the United States, a tiny fraction became extremely ill and did die, but we're talking on the order of 4 out of the more than 200 cases that were reported in that. So it's even when you're very sick, you are very likely that your child will recover.
That context is really helpful. Kind of shifting gears, I know a lot of parents understandably have maybe been hesitant to come in for their normal health visits, right? So
Mhm.
physicals, vaccinations, things like that. A lot has been put on hold. But why would you say those shouldn't be one of the things put on hold? And what do you want parents to know about that kind of re-engaging with your child's overall healthcare in this pandemic?
Boy, you're kind of tapping into why I'm a pediatrician in the first place. What is wonderful about kids is that when you do the right thing early in life, kids develop into amazing people. And part of the doing the right thing is is vaccines and that preventive health work that we do and the education that goes on there. When we had shut down all those primary care practices, there was a big drop in folks getting their recommended preventative care, including their vaccines, which puts folks at the risk of getting preventable infections and getting which also carry the risk of being of making them sick or permanently injuring them. I would say that right now, focusing on those preventive health measures is what we should be doing. Children's has all of its primary care practices engaged in very safe infection control practices so that well child visits can be done because we want folks to get the care they need so their kids remain healthy throughout this coming school year.
So that was my next question. And I know we have received a question on Facebook about back to school, and we are getting there soon. So wanted to address that. But what are those things, right? So if I'm a parent, I'm like, okay, children's, I need to come back in. What can they expect in terms of those increased safety measures?
Well, a lot of it is going to be screening before you get to the door. Because if anybody's got symptoms, we're going to make sure that that we protect you from other folks who are ill, and that we protect folks who are not ill from inadvertently getting something that you may be carrying, be it COVID-19 or just some other run-of-the-mill virus. We do universal masking and for everyone to protect them from coughing out droplets to other folks. Lots of cleaning of surfaces, a very regimented setting for that. All of your healthcare providers will be coming in wearing masks as well, so that if they're asymptomatically carrying something, they don't transmit it to you. We do some visitor policy limitations as well. And then in terms of number of parents or other siblings with you, we limit those as well, because the fewer people we get put together in closed areas like clinics, the less likely somebody's going to accidentally transmit something to somebody else. And there's more that we're doing. It's important to talk to your clinic to get your questions answered about that. And they also, I think, are doing a great job of talking to families beforehand, saying, here's how this is going to run.
Right. Yeah, and virtual care too. I know we have done over 20,000 virtual care visits in 2020, which is amazing and really a nice option for families if they're still a little hesitant.
Yeah, and I think to follow up on that, when we've asked families how virtual care goes, which I've seen it work from well child visits to really medically complex visits, about 90% of families have said this has worked out great. And we serve so many kids out in greater Nebraska where the drive is hard. We've had probably our biggest positive feedback from folks who are saying, look, you just saved me 8 hours round trip, and I can't thank you enough.
Right. So I'm going to shift to masking. We have a question about masking. First, just generally speaking, it feels like lately masking is almost a controversial topic in our culture. Some people don't think they're effective or needed. So I'd like you to explain just the why and the how basic of why masks are needed in this and why they're so important.
So the number one message I want to get across is that masks help you protect others from you, meaning that the small droplets that we create through talking, sneezing, coughing, singing, yelling, what have you, we're making all the time. And these tiny particles that float out in the air can spend many minutes out there and are easily breathed in. And the point of a mask, which I just happen to have one, me, who knew, is that these areas here, most of those little bitty droplets all hit here, right?
Mhm.
They're not going to go anywhere else. And I would probably say that I would open it up to face covering as opposed to just mask. Some folks are uncomfortable with something that tight on their face for a variety of reasons, but something where you have a face covering for your nose and your mouth so that those tiny droplets are hitting that surface and not floating out into the atmosphere is what the aim is. So some folks use bandanas. There's other types of face coverings that work that way. And the rationale is, it's like seat belts, right? In some to some extent, seat belts don't work perfectly, but seat belts save lives when they're worn, but they don't do any good when they're not worn. And so for masks, it's the same thing. They're not perfect, but they help you protect others from something you may not even know you have, or symptoms that you may not have. But they don't work at all if you don't wear them.
Yeah, good example. One question we've received is, if children get the mask wet, is it still protecting them?
It is, and the reason being is that the droplets are still hitting that surface. There's in talking to families, some folks, they'll have a mask for every day of the week because they're wanting to wash them or dry them or make sure that they're inevitably going to get soiled in some way, right? The kids are kids. Yeah. If you get a t-shirt dirty, you definitely run the risk of getting your mask dirty. But it doesn't prevent the droplets from smacking up against there and not floating out into the air.
Right. So speaking of kids will be kids, a lot of people are like, seriously, you expect me to have my, young toddler in a mask? And so that's my next question. At what age is it appropriate? And do you recommend parents start putting a mask on a child? Like, what age is the starting point?
So I'll start with what the American Academy of Pediatrics recommends. And the first is that as developmentally appropriate, try face coverings. And I say it that way because sometimes it varies a little bit based on the young child. So children under 2, they're not going to probably do it. And so that's not worth having any sort of struggle of wills. Children over 2, depending on what their level of development is, they may do it. I'll give you the example. I have an 8-year-old and I have he'll be a 4-year-old in 9 days. And the 8-year-old, easy peasy. We tell her, wear this to keep others healthy and to help keep yourself healthy. And she just does it. And she'll remind us. The almost 4-year-old, it's a very different thing. We just praise, so when we go, to swim lessons or another enclosed place, we don't make it a contest of wills either, because it's not the most important thing that we can do in a young child. There's other things that we can do as well. So the youngest is variable, and the way you approach it, I think, is going to vary based on development.
So just to follow up on the approach piece, right? Because it can be a hard sell at different ages. I mean, any other ideas? You mentioned praise, any other practical ideas to just get the buy-in and make it work, especially as with school coming up, if people are going back to school and need a mask for their child?
Well, the number one is if mom and dad are wearing a mask, then children are going to do it, right? That's the great thing, is that they'll follow an example, and that's often one of the most effective things to do. So, saying, oh, I got to remember my mask, that becomes a reinforcing cycle for the whole family. And I think for adolescents, there's where you can do logic a bit more, as opposed to just keeping it healthy. You can explain, well, you're doing that, and you can explain from the droplet standpoint. So I think just taking our own anxiety out of it, saying, I'm not injuring my child by doing this. I'm encouraging, and not putting it as something that's punishing or making them feel weird for wearing it. The more normal you make it, the less they're going to think about it and just do it.
I want to pitch out two common concerns that you do hear about masks in kids. We've all seen them on social media, that kids will not get enough oxygen or they're taking in carbon dioxide. And how do you respond to those concerns and those comments?
Well, I'd say that the first thing is when you look at the mask that we're talking about, and again, it just happened to be for my job. I happen to have a few, right? So I've got
I
one
hope
from
so.
UNMC. This is not airtight around there, right? So it's not, so we're not making this an airtight seal. We're making this a small droplet, not easy to get out of, right? And
Mhm.
so the teeny tiny air molecules are still getting through this just fine. The same with any of the cloth masks that we have. There's not, if you're doing regular breathing in and out, you should be exhaling all that carbon dioxide, no problem. The short answer is there's not any studies to suggest that in these sort of masks.
And so we had another question related to children with asthma. Should they wear a mask at school and out and about?
Well, the number one thing for kids with asthma, depending on their level of severity, is to make sure that they've got that they're taking their medicines regularly, so they're not having any exacerbations, any worsening of their symptoms, anything that makes them their breathing shorter. And to go back to what the American Academy of Pediatrics says, for health. A good face covering should not impede breathing. And so a child with asthma, whose asthma is adequately controlled, is at low risk of having any problem with a mask on. A child with asthma who's having a difficulty breathing and it's, an asthma attack, well, that's somebody that the mask is less important than their immediate health. And so you want to prioritize them getting their medicines to help them through their asthma attack. And the mask is not the most important thing for them at that time.
Okay, so everyone from Crayola to Old Navy are selling masks. Do you have any favorite mask for kids and teens? Anything to look for if you're a parent? A special material, a certain type? Any recommendation on that front?
I think if you make it personalized, I think that's great. The story I'll give you is one of my doctors here. Her mom, who lives out in rural Nebraska, made a whole bag full of masks out of t-shirts and quilt material and cloth of all sorts of different types, some for kids, some for adults, because when we're not taking care of patients, we use these cloth ones instead of the medical masks. And it was great. And so I'd say, make it something that you like to put on, right? There's not a it doesn't need to be heavy. It doesn't need to be super thick, because remember, you're not protecting yourself from breathing stuff in. You're preventing yourself from breathing out little droplets. And so fancy layers and all of that is not something that's necessary. And you don't have to spend a lot of money to make a good mask.
I like the personalization tip. That's a good idea to get kids more into it. Kids don't always get the concept of personal space either. So this social distancing stuff, any practical advice for parents on enforcing that in day-to-day life?
Boy, that's hard.
Yeah.
When you get down to it, there's some of it's going to be what the school can do in the classroom. At home, I always think about this as the bubble. You're trying to keep the bubble of people you're close to small, because you're unlikely to share a virus with each other if you're not going outside of your bubble much. For social distancing, if you're outdoors, it's not as big a deal, because we're out in the air, right? There's wind, there's everything circulating a whole bunch. When you're indoors, that's when the social distancing is much more important. And depending on how old the child is, encouraging that can involve things like where you're putting their chairs, and again, going back for classrooms, maybe it's tape and outlining places to be within the room, those sort of things. There's no perfect way to do it, but I wouldn't worry about it too much on the outdoor side.
So speaking of no perfect way, you kind of segued there anyway, is to talking about going back to school. So obviously this is going to be new, no matter how you slice it, no matter what you choose, it's going to be a new experience for everyone. And parents, understandably, it's stressful. People are conflicted. What is Children's doing to make this return to the classroom as safe as possible? How are we collaborating and serving the community in this really weird time?
Well, that's a whole hour unto itself, but I'll
Tomorrow.
but I'll say that Children's is working with school districts all over the region, all over the state, to help support the parents, the teachers, the staff, the administrators on making the best decisions they can for their communities based on their resources. That can range from trying to interpret the guidance coming from health departments and from the Centers for Disease Control and Prevention to the just the logistics of, oh gosh, what do we do for desks? What do we do for cleaning? To supporting school nurses as they're trying to figure out how they're going to best help students and parents. So it's all over the place.
So is there concern? I mean, there must be. What are your thoughts as kids go back to school next month about another surge? Or I guess how are we approaching this? How are you in the healthcare community as we make this shift in August?
Well, I'm going to give you a little story about what we saw when we shut down in the spring. And the first thing we saw was that all the little viruses that are circulating all the time, but can result in causing enough illness for kids to end up in the hospital, those weren't circulating. So shut down not just transmission for the coronavirus, but also the flu and RSV and all those other viruses the common cold viruses as well. And so it's inevitable that we're going to have some degree of transmission of some viruses when we get more people together. What we're doing now is I would say we're building the car as we drive it for trying to protect kids. And schools are trying to do different approaches. For those who it is safe and they get effective education, that there are folks that are opting for the distance learning. I will say that one of the things that we saw when schools went to all of that is that the kids most at risk of falling behind fell the most behind. And these are kids that don't have the resources for distance learning, don't have the family resources to get that done. Folks who rely on the school to help with supplementing nutrition for their families. And so all those negative consequences are still going to be something that we're going to have to grapple with, that put folks at a disparity from other families in the community. And that's the balancing act the schools are doing, is how can I make sure these kids and families don't fall behind and get hurt because we're not open, and minimize folks getting infections that could hurt them as well.
Another question related to schools reopening. What will schools do if they have cases of COVID? Would one case be enough to close down a school? How do you see that playing out?
Well, the first thing is that if you've seen one school plan, you've seen one school plan. And I don't mean that as a bad thing. Again, we're driving the car and building it at the same time. And we're going to learn what's going to work better and what isn't throughout the year. And so I don't fault any school's plan, because they're doing the most important thing, which is talking to families and teachers and staff and saying, how do we make this safe and how do we get kids educated, right? Many schools, what will happen is if there's a confirmed case, they will then do that case will go home or not come back into school, and they'll do contact tracing. And so a lot of school plans are focusing on, I talked about that bubble before, having the class as a bubble, right? If you make that bubble one that's not swapping people in and out very much, it's easier to say, all right, well, this whole class is going to go to distance-based learning and not come in for a while we do contact tracing and watch for symptoms. Some schools may not be able to do that. And if there's enough infections, There's school plans that say, well, we're going to have everybody go home, do distance-based, we're going to clean the school really well, and then start to bring people back. And what you're going to see is all sorts of responses like that. And frankly, it's going to depend on what we see in the community. Communities where there's not a lot of transmission going on, we're less likely to have the more drastic measures done, but there's a lot of transmission going on. The schools are going to be buckling down hard like the rest of the region would be.
So we do at Children's serve a wide regional area, but for the region, and I guess for Omaha at least, what would you say is the state of I want to say state of the union, but state of the community in terms of cases right now?
We're not at the forefront of high cases. We've had a relatively low activity throughout the summer, and which I think it's likely that that's going to change. We are there's only a few states that are still having lower numbers of cases where that's actually dropping over time. We're much better off than what is going on in particularly the southeast part of the country. The Northeast is actually not doing too bad in terms of getting fewer cases. We're not increasing very fast, and the Southeast is the Far West is probably the hottest spots right now.
And yet, and so I guess that does provide some good context. But again, when we hear the American Academy of Pediatrics saying we still recommend kids going back to school in person safely, and then you hear all this data in the news, why is it still worth fighting for? I guess, do you know what I mean? Why would you remind people the positives of the return to the classroom? Because sometimes, depending on what news you're consuming or your social media feed, it's very nerve-wracking, as you're alluding to.
I'll give a few examples. When there was a survey done of moms with kids under age 12 done across the U.S., compare this spring when schools were shut down compared to the prior spring, there was a increase in the number of households who reported food insecurity, meaning hunger due to inability to have food, or the fear of not having enough food, where they were going day to day or week to week. That increased anywhere from a third to half over the previous year. And part of that is because of the school programs. The other piece, when you look at who completes schooling at home, it's only for folks who are particularly households of color and households with reduced internet access, fewer than half will complete the schoolwork. And so you're talking about families who you want to succeed as much as every family having not succeeded during that time. And there's actually stories of schools effectively reopening in other countries where when they put forward, even with high prevalence, really strong, strict rates of school-based measures, that there's not a lot of transmission at the schools, right? So if we do our planning thoughtfully, we may be able to effectively minimize the risk so that it's more than balanced out by the benefits of schooling in person and in the school.
I heard a little hopeful note there when you said that other countries experience, it hasn't been too much transmission when they went back to school, because I think that's what we're all kind of holding our breath and hoping for. And I kind of want to end on that note, like from the clinical perspective, where's some good news? What are you hopeful about in this, as we are, as you use the car analogy, a little bit figuring it out as we go, since this is so new. What's keeping you going, and where's some hope in this for everybody watching?
Well, I in addition to my clinical work, I do a lot of research in infectious diseases and with clinical trials across the state of Nebraska. And I'll give you it for a few places. First off, for the state of Nebraska, I think there's folks that are engaged, that are looking to help out their neighbor, and that are talking and working on plans to make sure everybody's safe to the best extent possible. So I think that community spirit makes me very hopeful. Mm-hmm. The second is in terms of the research. There's several really promising vaccine candidates. And I think that we'll be hearing more about those and with opportunities to participate in clinical trials related to those in Nebraska in the coming weeks and months. The third, I think, is that there's so much that we've learned about how many more people had minimal infection, that when we first saw this, we only saw this really high death rate because there were so many people who had that we were only testing the most symptomatic, when it looks like there's a lot of folks who don't. So it may not be as severe as we thought, though that doesn't mean that we shouldn't be doing the things we're doing, because you just can't predict. And we're still talking about a very potentially deadly virus. So I think a lot of reasons make me hopeful. Treatments, I think, would be the other one, is that there's a lot of work in that area, and we're learning better how to, even if we don't have a medicine to treat the virus, we're learning better how to treat folks who have that, have the infection, and support them so that they can recover.
I'm glad you mentioned research. That's why it's so important. We see that right now very clearly. Any last words of maybe encouragement or reassurance for parents as they're just doing the best they can and trying to keep their kids safe?
Yeah, I think, as you think about the things we're trying to do to prevent infection, there are the things that you can do to prevent infection to others. And I think it's in that being generous like that to each other is going to be what helps us be successful this school year and beyond, as we wrestle with something we haven't seen before.
Well, certainly thank you for not only your time and sharing your expertise here today, but for the research and the advocacy we're doing with the schools and your part in that. Thank you for all of your efforts towards this.
All right, well, thank you for your time.
Really appreciate it. And thank you everybody for watching. We hope this has been of help to you. And certainly on our social channels, we're going to continue as we're learning more. And as we can provide any helpful guidance, we're going to do that on these channels. So please follow us here on Facebook, Twitter, Instagram, and YouTube. And always you can find us online at childrensomaha.org.